It is a potentially life-threatening condition. It impacts 500,000 people in our country. Alpha-gal syndrome is linked to a bite from the Lone Star tick. However, health officials at the federal level haven't ruled out other ticks, including black-legged or deer ticks.
Maine lawmakers are considering a bill that would require the state's CDC to track and report cases of alpha-gal to the feds. News Center Maine's Vivian Lee has more.
Right now, Arkansas is the only state in the country mandated to report cases of alpha-gal syndrome to the CDC. This, as the feds themselves say, there's limited awareness about this condition that's on the rise among providers on how to treat it or what it is. Ken McCulloch will never forget his reaction to the smell of barbecue while out in his yard.
And when the smoke would drift through our neighborhood a mile away, I would react to it. Couldn't breathe outside.
Ken, an accomplished musician, also had terrible GI symptoms after eating red meat. In August of 2021, after eating pork, he ended up in the emergency room hours later with heart failure. Things got worse after he was given heparin to help prevent blood clots.
Heparin's made out of pork intestines. They put that in my vein after eating pork and eating beef, and immediately, out like a light, I flatlined and basically died.
After being revived, Ken flatlined again at Maine Medical Center, also after being given the same medication.
I didn't know I had alpha-gal. The doctors didn't know that I had alpha-gal.
Ken was later diagnosed with alpha-gal syndrome, a tick-borne illness that leads to allergic reactions from eating red meat, including beef, deer, pigs, or goats. Some people also develop allergies to dairy and other byproducts from processing those animals, like medications, gelatin, and cosmetics. It is primarily linked to a bite from the Lone Star tick, but other ticks, including the black-legged and dog ticks, are potential carriers. Ken says he was bitten by 2 Lone Star ticks while living in Kansas and Florida.
I asked my wife to take me to the hospital.
Ken and other patients testified in favor of a bill requiring the Maine CDC to add alpha-gal to a list of diseases and conditions to be reported to the federal CDC. Experts say Maine does not have established populations of the Lone Star tick.
With this data, we can help prevent the spread of that aggressive tick.
Beth Carrison founded Tick-Borne Conditions United, which offers education, training support, and advocacy for AGS and other tick-borne diseases. The nonprofit has launched a campaign to get Maine and states nationwide to add AGS to conditions reported to the U.S. CDC. As for Ken, he always carries an EpiPen, even when he is performing, and avoids all red meat. He says he'll never stop trying to raise awareness about alpha-gal. Now, the Maine CDC has come out against the bill, which they say will be costly to implement and place an unneeded burden on allergists who don't typically report to the Maine CDC. Now, the bill is scheduled for a work session, which could take place in the next few weeks. In Augusta, Vivian Lee, News Center, Maine.
And we will have much more information about alpha-gal syndrome on our website and our News Center Maine app.